Hi, everybody. Welcome to Inside Scoop with Sue. And today we are going to be talking about the COVID vaccine for 12 to 15-year-olds and what's new in the news and what we know that can help put you at ease toward moving forward. So we are here with Dr. Anisha Abraham, a board-certified pediatrician and adolescent health specialist at Children's National Hospital in Washington, D.C. And we're also here with Nisaa Chaudhry. Did I say that right? Yeah. Thank you for the pronunciation there. Nisaa Chaudhry is an undergraduate student at American University studying public health and an intern for COVID and Beyond, at COVID and Beyond. Okay, so, you know, we are in this world today where we're getting so much news from so many different sources. And the one thing we know today is that the FDA authorized Pfizer, the vaccine from Pfizer for children 12 to 15 years old. And then we have this waiting for the CDC to come out with a statement. And then we have the World Health Organization. So Anisha, can you tell us a little bit about, like, what are these different things telling us?
Well, first, Sue, thank you for having me here in this forum to be able to talk about this very exciting development that we have a vaccine that may be available for kids as young as 12 through 15. We think this is, again, just a really exciting opening in terms of what we know and how we can best address the pandemic. And to come back to your question, what we do know is that the FDA has approved the Pfizer vaccine for kids that are ages 12 through 15. We are now waiting for approval from the CDC's advisory committee body, and we think from everything that we know and from all the data that we've heard so far that they will probably approve it as well. And that's the final step before young people can actually receive the vaccine in pediatricians' offices and in places around the country. In terms of how this relates to the World Health Organization, the World Health Organization is a global entity, and it certainly at this point hasn't made that recommendation yet, but we do think that the FDA and the CDC in the United States approving this will certainly pave the way for the vaccine to be also approved around the world for this age group. Again, really, really exciting news for many of us as pediatricians and caregivers.
So it is really exciting news. And for some people, it still falls into the, I need more information. So my question to you is, like, what can you tell us to make us feel confident at a moment where everything feels so unpredictable and there's not a lot of, no one can tell you for the past 10 years, this is how it's worked, right? So it's also fresh. So what can you tell us?
Well, I can tell you the good news, which is, again, that there has been approval from the FDA for the Pfizer vaccine for children aged 12 through 15. It's already been approved from 16 on up. And this was based on study that was done for adolescents, about 2,000 adolescents. And what we found is that approximately half of them received the vaccine and had 100% efficacy. They had a very strong immune response, even stronger perhaps than adults. 100% efficacy, can't get any better than that. And in the group that did not receive the vaccine, which is the placebo group, there were a few cases of young people developing the COVID infection. So again, we know that there's really strong data from Pfizer in this age group to support the vaccine. And this is, again, the reason why the FDA and the CDC are moving forward in the decision to make this available.
Issa, do you have anything to add? If you do, you can just jump in at any point.
Yeah, I think that children representing almost a quarter of our community that they live in, it's really important that we all help stop the spread together.
I would just add to what Nisaa just said that 1 in 5 infections right now of COVID-19 are actually among young people ages 18 and under. So that's an increasing demographic that we're seeing. And that's why it's, again, so important to be able to have this vaccine available to them. It represents about 17 million young people that we're talking about by, again, having this vaccine available from ages 12 through 15.
So the other side of the story, we asked people for questions. So the other side of the story is if everybody else is vaccinated and likely the kids were the problem, like we were worried that they were the super spreaders for the older people who were getting sicker. So if those people have gotten vaccinated, why do I need to worry about my 12 to 15-year-old?
Well, certainly children still can get the infection, and certainly adolescents can too. And I think the more important thing is there's the concern that if a child were to get very sick, then certainly there could be a chance that they could have more serious infection. We certainly have had thousands of kids that have been hospitalized, some with an entity called MIS, multi-inflammatory system involvement. There's also concerns of something called long-term COVID, where there can be long-term effects. So the reality is that even though kids may not get as sick as adults, there certainly are quite a few young people and adolescents that have become very sick, hospitalized, and some have died as a result of the infection. So it's very important to protect them. And probably even more importantly, and I know Nisaa can speak to this, by having vaccinations, we certainly are paving the way for kids to go back to a more normal life. For months now, probably almost a year and more, kids have not been attending school, not been able to do things like going to birthday parties or sleepovers or camps, not been able to do all those really normal, important things that they're supposed to do when they're adolescents. And by being able to receive the vaccine, it paves the way for them to go back to some of these activities over the summer, much less for schools and universities to be open and not to be constantly worried about exposure to infection or some of the other things that we've been so concerned about up to now. But Nisaa, please feel free. I know you're also thinking about this a lot, and you're thinking about this even for older adolescents. I'm just curious about what you think as well.
Yeah, you mentioned those crucial activities that adolescents have been missing out on the past year, and that's why vaccinations are regarded as like crucial for a sense of normalcy and returning back to the in-person activities that we love. That's in-person schools, sports games, and performing arts activities. We all miss them, and vaccinations are a step closer to getting those back. My mom is a teacher, an elementary school teacher in Alexandria, Virginia, and she got vaccinated back in January, and it was a no-brainer for her. To be back in person with some of her students has been what she missed for so many months in the difficult virtual distance learning situation. And I'm also a volunteer at literacy tutor for children in DC, and I miss being in person with my students as well.
Also, there's such concern about the mental health and wellness of our teenagers in particular. Like, that demographic has suffered so dramatically with not being able to socialize with their peers. And this is like the golden ticket. It's going to change everything.
Thank you for bringing that up, though. I just want to say so much of what I'm seeing right now in my clinic and certainly inpatient at the hospital are young people that are really struggling with all of what's happened with the pandemic. So a real increase in kids that are expressing that they're feeling anxious or depressed. We're seeing a real increase in eating disorder, certainly on the outpatient, but also on the inpatient level. And we're also seeing the ramifications, not just from the emotional side, but also from the physical side, kids that are not having the opportunity to get out and exercise. And so we're seeing more young people that are either overweight or obese. So as you mentioned, this is our golden ticket. This is such an incredible moment to be able to, again, allow kids to be able to do those things that are so important during adolescence, to be with others, to be back in activities, to be able to be outdoors or exercising. And I really feel like we're going to hopefully see a little bit of a change in some of these other concerning trends when we do get more young people vaccinated.
So I'm on board. I got a little weepy when I got my own vaccination. It felt so miraculous. But I know that there's a lot of fear out there that this vaccine happened so quickly, which we needed it to happen so quickly. But the flip side of that story is, did we have all of was the research done to a degree that we don't have to be suspicious that corners were cut? And I think that's the fear that's out there. Like, how do you take something and so quickly come up with a solution and then not be a little concerned about it?
Well, I'm going to maybe just start to address that. And I know Nisaa has also been really exploring this whole idea of vaccine technology. But just to say that mRNA is part of what helps this vaccine and is really what the basis of the technology. And this is technology that's been studied for many years. It is not something that's actually new. The COVID pandemic and certainly the virus has created an opportunity to use this technology that's very much been in existence for some time and to create a vaccine that's very efficacious. So again, I don't think it's novel. It's just that this application for this particular virus perhaps is a little bit more new. And again, the other piece I would just say is that the downside of not receiving the vaccine is potentially getting very ill or even death. And so I think many families need to think about that risk-benefit scenario and again, be informed to understand the technology and the science behind it is really important, because I think the ramifications of not taking it can also be very serious. Anisha, I'd love to also hear what you have learned and certainly want to share about the technology behind the vaccine and why it's so important.
For sure, yeah. A common myth is that these vaccines are developed quickly. That means they aren't safe. And it's just important to recognize that the clinical trials that examine the full safety and efficacy of the vaccine were not rushed or compromised. We have a lot of scientific advancements made over the past few years, and previous research was used and was extremely helpful in developing this vaccine. So if you have the chance to get it, this is the way to get back to the life that we once loved.
Okay, so I'm going to ask one of Renee's questions. Renee, I think is, kind of on the side of thinking that this is not a good opportunity. And her question is, how is the vaccine FDA approved for teens when the vaccine has never been FDA approved?
I'm not sure I follow that question.
I think Renee is saying that there was never FDA approval for the adults who got it. So how come all of a sudden, I don't know the answer to it. I don't know if it's legit or not.
I will just say that the FDA did have to create emergency approval for this, that they would have had to approve previous vaccines. So my understanding is that the vaccine had already been approved for people that were over the age of 18 and then over the age of 16. So this is just a stepwise process. And again, it just really ensures that all entities have really looked at the data and the science behind it to make sure it's efficacious. It's part of that check and balance system that's so important. And as a result, for those that are, again, concerned about it, I think they should also realize that there are a lot of folks that are experts in this area that are looking at all the data and science to make sure, again, that this is something that is really useful and as something that can really, again, continue to be efficacious. So I think this process is a good one and certainly important. It would be my response to that question.
Okay, and I also want to just say that I think the medical field, those people were the first ones out there getting the vaccination.
Yes.
So I found that very comforting because I'm not going to understand the research, but you do. And I have a real trust in that as a step forward move for me personally and my family. Nisaa, did you have something to add?
I would just like to echo what Dr. Abraham said, and that, like you mentioned, health professionals and doctors, the people working on the front lines, got this vaccine. And I think that is something to look at when we see that these are the people taking care of us, and they did take the vaccine, and that's enough to make me feel trusted, for sure.
And I just want to add what a tremendous level of hope the vaccine has given many health professionals. I will just say, having worked in the hospital setting where we are with patients on a daily basis, we're certainly interacting with people that potentially could be very sick or ill. And I can tell you the level of precautions that we've had to take in the past in terms of wearing gowns and wearing masks and wearing shields, which we continue to do. But after receiving the vaccine and knowing, again, the efficacy, I can just say that that level of comfort and knowing that we are going to be protected or not be as ill if we're exposed has really helped a lot of health professionals in terms of just feeling comfortable going to work every day, doing the jobs that we need to do, making sure that we also feel comfortable in terms of not bringing an infection home to our own families. So again, just to reiterate that many professionals have now received it, and it's really been so helpful in terms of decreasing our own anxiety levels, much less knowing that we are, again, protected in many ways from being infected.
Okay, so here's a few questions. What if your kid has had COVID? Is it still as important for that child to get the vaccine, or do they have antibodies that will protect them?
Well, I think the short answer is that it is still important because you can get COVID again. And we know that there are some antibodies, but those antibodies can be short-lived. So certainly getting the vaccine is probably a much better way to know that you're going to have protection for a period of time.
Nisaa, anything to add?
Like Dr. Abraham said, protection from the virus is most important. And if you can get the vaccine, that's going to keep you protected. So that's the most important thing.
Okay, so now you've moved into the space where you're on board and you want to get your kid vaccinated, but you know that there's been reactions to the vaccination.
Yes.
And so can you take something beforehand to reduce the reaction? Is that going to interfere at all with the vaccine?
That's a great question. And I know that in other vaccinations, sometimes people will take something like ibuprofen or acetaminophen to decrease pain or decrease swelling or fever. And the recommendation by the CDC is to actually not to take anything beforehand, with the concern this may actually decrease the immunity response, that immunological response. So we do say that probably the most common side effects, and certainly even from the trial with kids that were 12 to 15, 91% that did have a side effect experienced some pain at the injection site, and it was followed by perhaps having some fever or chills within 24 hours, and usually more with the second injection than the first. But these are all, in general, quite short-lived, and certainly just being aware that you might have it or you might not at all. And perhaps just taking some time to rest, but we don't recommend right now taking any medications to alleviate that.
Okay, beforehand.
Oh, correct, beforehand, yeah.
Okay, so there's a few things that are out there that I just want to see, are they myth or fact? And for, we're going to respect Dr. Abraham's response to this. So if you have a disagreement, you can share that somewhere else. So I'm just going to encourage you to respect the professional here on the call with us. So the first one is that the vaccine contains the virus.
As we just talked about, the vaccine actually uses mRNA, which in many ways actually induces an immune response to the virus, but it is not a live virus. So some people think that they might be shedding the virus after they receive the virus, but the short answer is it is not a live virus. It is one little snippet of the virus that again induces an antibody response, and that's again how it confers protection.
Okay, and there's this whole discussion around fertility. I've heard kids say they don't want to get it because they hear it impacts fertility or has, I don't exactly know what. Is that myth? Is there any evidence of that?
Nisaa, I'm going to let you take this one.
Yeah, so the vaccine does not affect fertility as what we know right now, but it does significantly lower the risk of having the COVID infection and the risk of having any severe implications caused by COVID.
Absolutely. So again, if you're thinking about the fact that people can die from it, and then thinking about long-term fertility, I think you need to just weigh those two. And as far as we know, there aren't any risks currently to fertility. And I would say that the likelihood, again, of getting very sick or dying are distinct possibilities without receiving the vaccine.
Okay, so here's my last one of myth or fact. Are people dying from the vaccine and we just don't know it?
I would say that the data has been excellent in terms of people not dying from the vaccine itself. Certainly, again, what we know from kids that received it that were 12 to 15 is that there was 100% efficacy. There was no reports at all of anyone of dying. We have very strong data so far, not only from children, but also from older adolescents and adults to show that this vaccine has a very good immune response and that people are not dying as a result. So I think that is certainly a myth. And I will also just add that there are people that are dying around the world, much less in our own country, from COVID and some of the variants related to COVID. And I think we need to take that very much into our own minds when we're thinking about whether or not to receive this vaccine.
Okay, so as somebody who worked through this as a healthcare worker, I mean, it seems like we're so quick to forget what that was like for people, how traumatized healthcare frontline workers were from dealing with the death and the long-term effects of COVID. So can you just kind of tell us a little bit of the experiences you were hearing from people who were working in COVID units?
It's just mind-boggling what healthcare providers have had to experience over the last probably year. And this is not just here in the United States, but certainly around the country. There's been, of course, tremendous amount of uncertainty initially in terms of how it could be transmitted. We have now a lot more good data in terms of saying this is something that's respiratory, and that's why it's so important to continue to use masks, and of course, good hand washing. But again, there was a lot of uncertainty initially as to how it was initially how someone could be infected with it. And as a result, there was a lot of fear among healthcare workers in terms of just doing their jobs and getting out there every day and taking care of others, and whether or not they would get infected and certainly bring it back to their family members. So I think that fear is not insignificant. I will just say that my family is from India, and I'm talking to my family and health colleagues in India, and they're still struggling with these issues day in, day out. One of my physician colleagues in India said he lost 6 people in his own circle in just the last week, much less other health providers. There are people coming in and they're having to make choices in terms of who they can support and who they cannot. And this is still occurring around the world. And that's why we have the ability to give something that can prevent that, especially with variants that are circulating. And I think it's so important to seize this moment and to really make sure that we are fully protected and that we can go back to normalcy and not to that situation that still many providers and many hospitals are facing in terms of shortages and challenges and really terrible circumstances.
Thank you. Okay, so I'm going to let each of you say something to close. So Nisaa, do you have anything you want to share with everybody?
I want to say that the best way to reach herd immunity is through vaccination, and by vaccinating youth. Like I said, they represent a big part of our community, and we need them to do what they can and their families to end the pandemic as well.
And COVID, and I was just going to say that Nisaa is working with a fabulous team, and maybe you want to just mention the team that you're working with, and if anyone has more questions, particularly if they're a young person.
Yes, for sure. So I'm interning with @COVID and Beyond on Instagram, and it's a organization I've been volunteering with and most recently began interning with that provides a plethora of information about the COVID-19 virus and other health issues that impact youth. And not only is this platform amazing for understanding the pandemic, but it also helps with providing a sense of understanding and security that healthcare professionals are listening, and they're hearing what youth have to say about the pandemic and their experiences with it.
So that they can go to the platform on Instagram and ask questions there and reach out to you?
Yeah, so we do Q&As on the Instagram story feature, and there's live features and there's a bunch of posts, so it's very interactive.
Okay, Anisha, before we let you wrap up, can you just answer Jill's question? Are they actually vaccinating teens now? Like, can you make appointments yet?
We can certainly make appointments, and I know even in our own hospital, we have 6,000 people that are currently on a waiting list, ready to go as soon as we get the green light. So the short answer is this is a great opportunity for you to reach out to your pediatrician or healthcare provider to find out how you can receive the vaccine. Along those lines, I will just mention that the American Academy of Pediatrics is very concerned that young people have been missing opportunities for other vaccinations because they haven't been going in. So do talk to your healthcare provider about other vaccinations that they may need to receive in addition to the COVID vaccine. And my final point is, as an adolescent health specialist, this is an important time to also talk to your teenager. I know we're talking a lot about what parents should do and how parents need to be informed, but a lot of my work is talking to young people and making sure that they are part of the decision-making process and certainly that they are informed. And I will say that a lot of young people want to just move on. They want to go back to a normal life. So for anyone that's out there listening, this is an important time to have a conversation with your teenager about how they feel and what they know and how they can be fully educated about what's out there and going to reputable sources like the CDC to get good, science-backed information. But do take time to talk to your own kids about what this means and what they would like to do. And then certainly also reach out to your providers to get more information about how best to receive the vaccine.
Nisaa Chaudhry, thank you so much for being here with us. Dr. Anisha Abraham, as always, we're so grateful that you took your time this morning to help us figure out how we move forward with this. Thank you so much.
Thank you.
Thank you.